This discussion is another step towards ensuring that science continues to inform policy, shape strategy, and drive progress in Sri Lanka. Ladies and gentlemen, I now invite Professor Ajith Abesekara, President of the National Academy of Sciences, Sri Lanka, to deliver the introductory remarks. Over to you, sir.
Honorable Minister, ladies and gentlemen, I'm very happy to have this opportunity to make a few introductory remarks before we start the actual session at this symposium. First of all, I need to say it is really heartening to note that the work initiated by the Academy in 2023 on institutionalized science advice to government is being followed up with our program today with the recognition of the Ministry of Science and Technology of the government of Sri Lanka. Of that work itself, there will be a virtual presentation by Professor Nadira Karunavira, who was the president of the Academy at that time during this morning. Professor Saroj Jayasinghe, who played a key role in that work, will in his presentation be discussing, amongst other aspects, the way forward from where we are today. With the complex problems facing societies today, governments and policymakers have never been more in need of evidence-based science advice. However, it is, I think, maybe pertinent to remember two things about advice. One is that advice can be given but not heeded. The other is that you may be searching for evidence, but there may be nobody around to give you that evidence. So neither of these are desirable positions to be in when it comes to the government and science advice. And one solution may be the institutionalization of structure and development of structures which can provide science advice to governments. And that's what we are discussing here today. Many different countries have different methods of doing this. None of those systems are perfect, but we have to evolve something that would work for Sri Lanka. Now, policy making, of course, can never be based only on consideration of scientific evidence, if not for any other reason, that if you have any controversial issue, the scientific evidence on a particular viewpoint can never be unequivocal. Even in the situation where there is very strong scientific evidence for a particular viewpoint, policymakers will still have to consider many other factors, such as public opinion, political ideology, and the perceived priority of immediate versus long-term effects of a particular action. However, any policy which totally ignores the irreducible and stubborn facts generated by scientific inquiry. Irreducible and stubborn facts is a term used by the mathematician philosopher A.N. Whitehead in his remarkable book on science and the modern world. So any policy which ignores that is very little chance of actually having any overall benefit to the community. It is also my view that independent organizations such as the Academy, which can be outside the institutionalized science advice structure, which can nevertheless provide evidence to the government when requested, and which can move from science advice to science advocacy when there are matters of critical interest to the community at stake, are also necessary for any country. Science advocacy by an independent body will always be viewed by the public, and therefore more implementable, as being less likely to be driven by self-interest rather than advocacy by individuals, however eminent they may be. So with these few remarks, I would conclude my introductory remarks on the aspect of science advice, and I look forward to a thought-provoking and productive session today. Thank you.
Thank you, Professor Abeysekara, for outlining the context of this important discussion. It is noteworthy to mention that this event is being streamed online through the official YouTube channel, and also participants who are abroad will be joining this event through Zoom. And now, ladies and gentlemen, our first session focuses on the NASSL IAP report on institutionalizing science advice, a milestone document that captures both Sri Lanka's journey and regional experiences in strengthening science advisory systems. This presentation is by Professor Nadira Karunavira, immediate past president of the National Academy of Sciences, Sri Lanka. Professor Karunavira is an internationally recognized medical parasitologist and senior professor and chair parasitologist at the Faculty of Medicine, University of Colombo. She is the founder president of the Sri Lanka National Chapter of the Organization for Women in Science for the Developing World, and is ranked among the top 2% of scientists globally. She is also a visiting fellow at Harvard University and a fellow of TWAS, the American Academy of Arts and Sciences, and the American Society of Tropical Medicine and Hygiene. Although Professor Karunavira is currently overseas and unable to be with us in person, she has shared a recorded message and a presentation for today's forum. Ladies and gentlemen, let us now listen to Professor Nadira Karunavira's message.
Good morning. It's a pleasure and a privilege that I get to make this presentation on the study on evidence-based policymaking in the Australasian region. This is a study that was done through the National Academy of Sciences of Sri Lanka. It was in fact conducted a few years back during my tenure as the president of this academy. COVID-19 pandemic, I'm sure we all remember, really highlighted the need for an effective process for scientific evidence to shape government policies. This was true for many parts of the world, including Sri Lanka. So this, in fact, acted as the trigger for this study. Discussions were initiated. In fact, it was initiated by Professor Saroj Jayasinghe, who will speak shortly, and it gathered momentum within the council of the academy, and that's how this study came about. We all felt the need to establish a process for evidence-based policy making and to initiate action towards building a framework through a proper study. So the aims of this study were to do a situation analysis. This was in fact the main aim, to a situation analysis of processes that were in place and institutions that were involved in science advice in countries in this region, and to share best practices and to lay the foundation for establishing an independent and evidence-based system to aid policymaking. This was a collaborative study with 10 partner countries in this region. The country names are given here in alphabetical order. With Sri Lanka, there were 11 countries involved in this work. And who were the study partners? They were the academies and associations that are members of ASA, which is a network of national science academies in this region. and the partners were the ones who agreed to be included in this study. The national academies who were involved are listed here, and the geographic distribution of the countries that they represented are shown with these red symbols in this tab. So the tool that was used to gather data was a questionnaire, and this questionnaire was developed based on existing literature as well as through consultative interviews with a few experts. The questionnaire was tested through a pilot study, it was validated, and the finalized questionnaire was shared with all partners to collect information or data. It was an extensive, very lengthy questionnaire which covered many areas. And these areas included science advisory models that included advisors, advisory bodies, advisory office, or whether it was a mixed system that was practiced. Then some details about the appointing authority and how these officials or the body members were selected and who framed the question initially. Then how the data was collected and how data was analyzed and scientific evidence was synthesized and these processes were recorded. And of course, we wanted to know whether there was a role of policymakers during this process and whether there was interaction with the scientific experts during the process of evidence gathering. Then the nature of evidence used and how conflicting evidence was handled was also looked at, and how the uncertainties were conveyed. The scientific evidence gathered needs to be communicated to policymakers, and we recorded how that was done. Then the level of transparency of the process was noted, together with process evaluation and impact assessment, if there was any. Then the involvement of science academies was also noted in each of these countries. The collected data was analyzed using what we refer to as the Colombo framework, which provided the situation analysis of the science advice systems in each of these partner countries included in this study. In summary, it showed that the regional countries surveyed used diverse structures or processes related to scientific advice. This included science advisory councils, agencies or boards, and these bodies were the commonest that was recorded. And most of these countries used this system. And in addition, some of the countries also had a chief science advisor. Then there was ad hoc appointments made by way of task forces mostly in a few countries. How the advisors were selected again it varied in different countries. Appointment could be by an executive authority or nomination by science organizations. And who framed the questions initially? Usually it was by policymakers or parliamentary committee or by the head of state. Then synthesizing evidence, the method used included systematic reviews, meta-analysis. In some instances, surveys were done with consultative meetings. Expert opinions were sought in some cases, use of foresight tools, and workshops and meetings of experts for review of evidence. The gathered evidence needed to be communicated, and the communicating science advice was usually done through reports. And these reports were issued by the science advisors or the bodies involved, and it was directed sometimes directly to the presidential office or to a cabinet office, or submitted through the secretary of the Ministry of Science and Technology to the head of states, or sometimes reports to the relevant minister and presidential secretariat. The effectiveness of the process or the impact of scientific evidence that shaped policy was rarely evaluated. That was something important noted. We also noted the role played by national science academies varied from country to country. In some countries, there was full involvement of national science academy, while in some others, only for targeted activities. The data gathered through the questionnaire was also used to do a SWOT analysis. That is, strengths, weaknesses, opportunities, and threats were listed out using the data that were gathered. And this is what we found for Sri Lanka. But I'm not going to go into details because this is also part of the report and it is out there in public domain. So one of the aims was to develop a contextualized roadmaps for each of these countries. And we used the experiential learning and also SWOT analysis and teasing out its key elements. The foundation was laid to develop context specific roadmaps for each of these countries. Some countries already had a system, and this was used for improving the system that existed. So the key findings were the effectiveness of science advisory mechanisms in countries tended to vary. Even in countries that appeared to have similar systems, superficially did not seem to have the same level of operational effectiveness or impact. This showed the importance of mechanisms that are used in this process. Malaysia stood out among the regional countries in having a strong science advisory system in place that aided policy making in that country. The key outcomes were this became a landmark effort. This was the first time science advice systems in countries were documented with situation analysis, which was reinforced with SWOT analysis and also case studies. I really didn't go into case studies, but that was also done. All partners agreed to work towards developing context-specific roadmaps tailored to their own settings, with all stakeholder involvement. This effort also resulted in release of what we refer to as Colombo Declaration, which called on governments across the world to institutionalize science advice. And this declaration was disseminated widely through many websites and networks. This is the Colombo Declaration, and all the national academies that were part of this study were the signatories of this declaration. So now we have this validated questionnaire to gather data, a framework for analysis, and methods to replicate similar studies in any part of the world. And the report The final report was published and disseminated widely through local and international scientific networks. This, we believe, promoted awareness mainly among the scientific community, including younger generation of scientists, creating opportunities to be part of this transformative process that, of course, is continuing. This is the first page of the report uh, that is out there on the web. It is also shared through the Open Science Framework in addition to the Academy website and IAP and NASA websites. Before I end, I would like to acknowledge others who are involved in this work, the co-members of our project team. The other members were Saroj Jayasinghe, Priyan Dias, and Ranjit Mahindapala. Professor Nilvala Kottegoda and Nestec for assisting with data collection on processes that are in place in Sri Lanka. And I would like to acknowledge ASA and Inter-Academy Partnership for financial assistance, which enabled this work. And also study partners from regional academies and societies who contributed to this work. And thank you for your patient listening.
Thank you, Professor Karuna Avira. And ladies and gentlemen, now we move to the second session, which introduces the Colombo Framework, which is a structured and forward-looking approach to embedding scientific evidence into public policy processes. To introduce this framework, I would now like to invite Professor Saroj Jayasinghe, Fellow of the National Academy of Sciences, Sri Lanka. Professor Jayasinghe is an emeritus professor of medicine recognized among the top 2% of scientists in the world. He is also a fellow of the International Science Council and serves as an advisor to the ISC's online course on science advice. Professor Jayasinghe has been a pioneer in initiating Sri Lanka's national project on institutionalizing science advice, playing a central role in promoting evidence-based policy making within government institutions. Ladies and gentlemen, please join me in welcoming Professor Saroj Jayasinghe to present the Colombo Framework.
Good morning to all of you, Honorable Minister, and invited colleagues and experts. This one. Yeah, we are gathered here today to see how we could strengthen this path of getting evidence to policy. Now the terms used include science advice to policy or science advice to governments, and various similar terms are used. So what I hope to do is to describe some of the basic concepts so that we are all on the same page. Now this might be something too superficial for policymakers, but I think for scientists it's important that we realize what we mean by science advice. So you can use these terms like evidence to policy or E2P or whatever, but the idea is basically obtaining and using the evidence which is out there to policymakers and politicians and so on. And when it comes to evidence and gathering evidence and synthesizing, I think the scientists have an advantage because we know where the evidence is. We have methods of synthesizing the evidence, collecting the evidence in a systematic way without bias, so that we present it to the policymakers and then they do what they think is right. That's one fundamental fact of life which scientists must understand. Just because you give evidence, that does not mean that the policymakers have to follow it. They have other factors to consider. Global geopolitics, local politics, elections, and those are realities which they have to take consideration of. So it's going to be a brief presentation. I'll introduce some aspects, why this whole process came about. I think it's important, and we'll be reiterating some of these in the panel discussion which follows. A few concepts and a brief situation analysis of the science advice to policy in Sri Lanka, and a framework to understand. We all remember the COVID pandemic, and I think it's fairly recent enough for us to grapple with this situation. Though we have been blamed about the various interventions which we did, Sri Lanka has done remarkably well. Remarkably well. In other countries, they are still dying from COVID, especially the elderly are dying. And when they looked at the manner in which countries tackled COVID, they realized that there were a lot of gaps in this institutionalizing of evidence, how different countries responded. You must remember the situation we were in. It's very easy for us to say we should have done X, Y, or Z. But remember, we did not know that it was going from it was spreading, how it spread. We didn't know whether we should be wearing masks. In fact, the WHO said, do not wear masks. We didn't know how useful washing your hands were. We had separate things being invented to wash hands and even spray various things on our bodies. And one president in another famous country wanted to give the detergent to their people. So we didn't know what was happening. And it's important that how a country should respond to this sort of crisis or any other policy. And these have been tracked and explored in the literature. So you have tracking policy against COVID, which has been done by Oxford, the Oxford Super Tracker, and then the International Network for Government Science Advice, which also has tracked policy. And we realize the different ways we have institutionalized this process. So now I want to get to the basic concepts, because it's important that we understand this. And if you are to build capacity, we must know what we are talking about. This is the common mistake we make. When we talk of policy and science, we always tend to talk about policy about science, prioritization of science, prioritization of research, management of institutions, how are we going to give the grants and getting more grants for our researchers. But by science advice to policy or evidence to policy, we are flipping it the other way. And that's very important to remember, especially for the scientists, because we are very familiar with this aspect. So in this process, you're using evidence to guide policy. So it's not a case of policies related to science, but you're gathering the evidence to policy. Now, does that happen? Yes, of course it happens now in an informal way. Policymakers are able to obtain scientific information, it's available. You can have scientists who are in fact formulating policy. We see that all the time. Scientists embedded in committees or in even in government ministerial positions. But in this whole discussion on evidence to policy, what we want to do is to make this pathway of evidence to the policymakers in a streamlined and institutionalized manner, so that it happens like a normal functioning system, right? So this is not ad hoc where you give a call and say whether we should be bringing in fertilizer or what type of fertilizer we should be importing to the country. No, there is a well worked out system. Yeah, so this, the first one versus the second one. So what's the situation in Sri Lanka? If you are to improve this pathway, what's the situation in Sri Lanka? What are the mechanisms which provide evidence to policy? I've done a brief check on the literature, and you find we have science advisors who have been appointed periodically. We have advisory agencies like the National Innovation Agency. We have a mix of experts coming in, as we saw with the coordination team secretariat, etc. for COVID. We had advisory councils, and I don't know whether the Sustainable Development Goals Council falls into that category. We have commissions like the National Education Commission, and we have several ad hoc arrangements like presidential task forces from the time of Honorable PM, Prime Minister or President Premadasa. We've had series of presidential task forces. So it's a case of looking at this situation and understanding the sort of mechanisms we have had. And when you go through their specific acts, it's again not clear what and how they're providing evidence. See the words which have been used: recommendations in one, formulating in another, recommendations in the National Education Commission, advising the government on policies by NASDAQ. So you have different words being used, different models being used, and it's important that we understand the background of this if you have to move forwards. So in this study, we developed this Colombo framework, and we are using the word Colombo, and we are trying to brand things so that these become important internationally. Sri Lanka, Colombo, right? So that's the idea. So we use this to help us understand this process. I'll take you through this process. These can be improved, and this will become important when it comes to capacity building, SLIDA, when we try to tell scientists what we mean by getting evidence to policy. In fact, a recent paper in Nature, one of the most prestigious journals, stated that we have to train scientists on how to provide evidence. So let's go through this simple framework. Though things don't happen in a very linear or a circular fashion, it's for convenience and to understand the necessary concepts. So from policy, there has to be a need to obtain advice. You have to frame the proper questions. You have to then gather evidence based on the research question. because from that beige to blue, the framing has to be done by the scientists and the policymakers working together. Then you gather the evidence, synthesize it, and communicate it and get it back to policymakers. So the need could arise from policymakers. And in this instance, we have to think of the higher levels. We are not talking of a department in a ministry. That's also important, but that's a different set of advice you require. We are talking at the national policy level, at the ministerial level, at the sector level, or at the cabinet level. How do you get the evidence which is available? So policymakers, parliamentary committees might say you want some evidence related to a particular aspect. And then the framing of the question is basically converting these problems which are there in the minds of the policymakers to a scientific sort of question. So when it was about COVID, how to reduce spread, then the question is, what's the mode of infection transmission? What's the cause? Initially, we didn't know it was a mRNA virus, right? What's the virus? How is it spread? What's the dose required? What's the social distancing, and so on? And then you have to gather evidence. Now, this is where the scientists have an advantage, because we have systematic ways of gathering evidence using certain search criteria. Now, of course, AI can complement it, but you have to ask the correct questions from the database to gather evidence. And there are so many sources. For example, in some of the discussions, you find people just quoting and building their whole argument on a single paper. You can't do that. The scientists know that you can have different results for the same question from different sources, and you have to synthesize this using systematic review process or meta-analysis. There are scientific ways of synthesizing conflicting evidence. You can resort to expert opinion, policy papers, workshops, reports by international organizations which tend to synthesize the knowledge for us. Then you might want to do the process if the synthesis has not been done, then the process must include synthesizing. So there are ways of developing consensus. Again, systematic ways of doing it, not over a cup of tea. There are systematic ways of arriving at a consensus and stakeholder engagement. In all this, Dr. Vinya will tell us about the importance of community engagement in this process. How do you communicate? Again, coming from the science field, we are very poor at communicating. We think when we write a letter to the Presidential Secretariat, the President is supposed to read your policy document and include it in the next budget. I mean, that does not happen, right? That does not happen. He probably gets about 10,000 letters like that. So you have to communicate. There have to be paths for communication. You have to avoid jargon and simplify it. Now, for example, in UK, the science advice, they make policy papers relevant to some of the discussions which are going to happen in the parliament. It's available for opposition as well as government. It's available in their library. Now, in Sri Lanka, apparently the parliament library is one of the least used places. But things have to change. Things are changing, I think, because we are having people who understand. We are having people where we can discuss. When we say we want a systematic review, now the ministers seem to understand what we are talking. So we are bridging that gap. But it's important that we have protocols and methods for communicating worked out, right? So you will see that if you have to really disaggregate this idea of getting evidence to policy, there are several steps which we have to go through. And when we go through these steps, we have to have a institution, some sort of mechanism which will do that for us. Even if all of us are dead and gone, the system should continue, right? So if you are to do that, you have to make sure that it's conducted in a way which is without bias, where there is enough diversity, those are the values, there is transparency, there is conflicts of interest are minimized, you don't get your personal biases into it. If you're a CEO or in a director board of an organization which is going to be influenced by the policy, explicitly state it or don't get involved in the decision making and so on. So those are also important if this is to succeed. And at the end of the day, we have to think of setting up institutions. This is why this term, institutionalizing science advice, because we need a sort of an institution, mechanism for this process. So it could be multiple institutions like the Education Commission and so on for sectors. It could be advisory councils for ministries. It could be a National Development Council, which we had some time ago, which Malaysia has at the cabinet level. It could be an advisory board advising the president. There will be several models, and we should have all those diverse models depending on the need. So each sector or each group could have its own structure. And we will need to look at the existing legislation, think about amendments or new regulations, or maybe new legislation, new institutions, and a whole set of circulars. So this summarizes, we started with COVID as an example. That was a need which showed us the varying experiences we have had of getting evidence to the policymakers, and below is the sort of framework which we can use. That's all I've got to say. I think we next get on to the panel discussion. At the end of the day, these are some of the topics which might be covered in the panel discussion, our previous experiences, so elaborating on the situation we have been in and what it means to institutionalize, why is it important, community engagement, and at the end of the day, we have to really, from when we finish this activity, we should have some idea as to how we are going to move forwards, the way forwards. Right. Thank you very much.
Thank you, Professor Jayasinghe. And now, ladies and gentlemen, we will move to the third session, the panel discussion on the way forward, where a distinguished group of experts will share their perspectives on the next steps of institutionalizing science advice in Sri Lanka. Ladies and gentlemen, allow me to introduce our esteemed panelists. Mr. Y.L. Mohammad Nawawi, Secretary, Ministry of Science and Technology. Professor Saroj Jayasinghe, Emeritus Professor of Medicine, Fellow of National Academy of Sciences, Sri Lanka, and the International Science Council, advisor to the ISC's online course on science advice, and pioneer of Sri Lanka's national project on institutionalizing science advice. Professor Priyan Dias, past president of National Academy of Sciences of Sri Lanka and former director of research at University of Moratuwa. He served on the National Research Council for over 15 years and is currently engaged in NASSL's initiative to rebuild trust in science. Dr. Sirimali Fernando. Dr. Fernando is a fellow of the International Science Council, the National Academy of Sciences Sri Lanka, and the Sri Lanka College of Microbiologists. She has served as chairperson of the National Science Foundation, science advisor to the Minister of Science and Technology, and Secretary General of the Sri Lanka National Commission for UNESCO. Her distinguished leadership has made a lasting impact on shaping both national and international science and innovation policy. Dr. Vinyari Ratna. Dr. Ari Ratna is the president of the Sarvodaya Shramadana movement and specialist in community medicine, a past president of the Sri Lanka Medical Association and the College of Community Physicians. He has extensive experience in public health, community development, and humanitarian work both nationally and internationally. Mr. A.V. Chanandra. Mr. Chanandra is the Director General of the Sri Lanka Institute of Development Administration, SLIDA, a senior officer of the Sri Lanka Administrative Service. He is recognized for his progressive leadership in strengthening public sector capacity, promoting innovation, and advancing professional development within Sri Lanka's public administration. Dr. Iresha Athanayaka. Dr. Athanayaka is a senior lecturer in mechanical engineering at the Open University of Sri Lanka and the director of the Center for National Online and Distance Education Systems. She also serves as Joint General Secretary of the Sri Lanka Association for the Advancement of Science. The panel discussion will be moderated by Dr. Ranjit Mahindapala, Fellow and past President of the National Academy of Sciences, Sri Lanka. Dr. Mahindapala brings over 35 years of professional experience in project design, planning, and evaluation across Asia and the Pacific. He served as Program Manager at the International Union for Conservation of Nature for a decade, and later as an independent evaluator for UN agencies, the European Union, and other international bodies. He has led numerous multinational evaluation teams and organized 3 evaluation conclaves for the community of evaluators, South Asia, with global participants. Ladies and gentlemen, I now welcome all panelists and Dr. Mahindapala for the panel discussion.
Well, I'll just say something.
Since the Secretary of the Ministry of Science and Technology is not here with us now, Dr. Prabhat Abesirivardhana, who is the Director of Planning of the Ministry of Science and Technology, will represent the Secretary.
Thank you, and a very good morning to all of you distinguished guests and fellow academicians and participants here. We are indeed very pleased to be engaged in this conversation this morning because as Professors Karunaveera and Professor Jayasinghe, I think very clearly put forward what the academy has done in the recent times in relation to developing a system for taking science advice for policy making. Professor Karunaveera very particularly said very briefly the overview, and Professor Jayasinghe, the Colombo framework, which really is something that we would like to take forward. The whole purpose of this endeavor, including this today's meeting, is to agree, if possible, on the modus operandi of taking this forward. Because the academy, this is the first time the academy is actually speaking to the Sri Lankan policy and scientists and those in political leadership about how this might be taken forward. Now, the panel, we have panelists, very eminent professionals, both fellows of the academy as well as others, who will post some thoughts on how we can work forward. We had this exposition, the COVID-19 as a background. And since then, we have seen both good and bad instances and experiences of policy decisions. Now, the health sector has some excellent examples of how scientific advice has shaped policy, numerous things. And of course, it's not that difficult because it's a matter of life and death, so people just accept it. But on the other hand, we have not so good experiences, particularly in agriculture in the recent times since COVID, which have actually led us to think through this process very carefully. Before I conclude, I like to highlight one aspect which both Professor Ajitha Besekara and Professor Jayasinghe highlighted. That is, we can have very solid evidence, but which may not be palatable to all. I think the key point here is that we need to balance this. The evidence, the strength of the evidence, yes, as against the other socio-political and economic factors which the scientists may not always think through. Just to conclude, I will give you one good example. There was very solid evidence gathered on how financial subsidies for coconut plantation should be given. There was a very clear scientific evidence by classifying our coconut soils on their productivity. And the recommendation was that the government should focus its subsidies to the lands which are most productive, so that the national production will increase. But that was, of course, not politically correct. The minister will not be able to give subsidies to certain areas of the country and not to the others. And he openly did not agree with the policy, the recommendation. But then I later found that he had asked the officials not to entertain or delay applications from those areas which are not good. Basically saying, right, give your subsidy to good lands. So these are ways of doing it. You don't have to even make policy, but it all depends on how individuals can act. And thank you. We have, as already mentioned, we have a very eminent set of people here. I will first invite Professor Priyan Dias, past president of the Academy, who will talk about the past experience of science advice in Sri Lanka. Priyan.
Thank you. Thank you for the question, yes. So I think the speakers have already dealt with this in various ways, but I will just give a few thoughts and try to be a little controversial also in what I say. So for example, I mean, we had Saroj Jayasinghe presenting this final slide, which gave the idea that you go from evidence to scientists to policy. So, of course, in his presentation, he indicated that it was not a linear process. There were some circular processes that were described and things like that. But I think it appears to me that, you know, when we have this science governance nexus, in most cases, you know, people who are in office, in power, do not wait for scientists to gather evidence. I mean, they have their own programs of action. And so the process actually is driven more from that side. Of course, you did mention something about framing the questions and things like that. But if you look now, Sri Lanka, when I was coming in the car, I heard something about Sri Lanka being very resilient, and I think we can all agree with that. But you know, we have brought upon ourselves some, you know, very terrible things that we could have easily avoided. I mean, and many of those things have been science-based problems. For example, we had a ban on glyphosate, which was reversed later on. But if I'm not mistaken, the tea industry is still recovering from that situation. Then we had the situation, once again, as Ranjit was talking about agriculture. Unfortunately, we have had some bad experiences. The decision to switch suddenly completely to organic agriculture. And once again, you know, the impact that that has had. Then COVID, we have done quite well, but I think there were some difficult decisions about barriers. And in that process, I think we alienated a significant part of Sri Lanka's population, a community in this country. So the thing is, and then of course the economic crisis. The economic crisis, now actually the Academy of Sciences, economics is also part of one of our sciences, so that comes under the social sciences. And that was the application of a particular theory, modern monetary theory, if I'm not mistaken. And whether that can be applied in a developing country context or not. So it was also a science-based problem. Now the thing is, in all of these situations, it's not as if the government is acting on one side and the scientists are against it. No, it's not like that. It's not so simple. Of course, there were various letters to the newspaper and things like that in all of these situations, giving science-based alternative arguments. But the people who took these decisions, the people in governance, they had scientists who were backing the kind of actions that they took as well. So I think that point was highlighted maybe by Saroj, or yeah, I think Saroj and even Ajit, that scientists will not always agree. Scientists will not always agree. So this highlights actually the need for this kind of institutionalization. Because, okay, one problem is the fact that, you know, even though the evidence is the best possible scientifically, that is not the only consideration that those in governance need to look at. There are various other considerations, like of equity, of political correctness, and all of those things. Separately, you know, scientists themselves will disagree on issues. So when we talk about evidence to policy, that evidence may be conflicting, that evidence may be interpreted in different ways. So what we are trying to say is, what I am trying to say, and I think I am reflecting in a sense what the academy is trying to do also, is that we need some kind of institutionalization to deal with all this diversity. I will make one final comment, something that I think those of us who are scientists will be aware of, is that science is done always in a critical framework. I mean, we might have a great idea and write up a paper about it, but that is not going to see the light of day unless it gets through the referees. And a lot of us know the pain of having referees reject this paper and submitting it to other journals, making corrections, and all of that kind of thing. So I think the reason science has progressed through the centuries and has achieved such sort of great success is because it has been conducted in a critical framework. I think this is something, the spirit of being critical is something that I think maybe we can try to encourage policymakers and those in governance also to adopt. That just because you have a scientist who tells you something that is palatable to you, I think it's good once again through this institutionalized framework to seek out views of scientists who may be having other ideas and to come to some kind of synthesis about it. So basically what I was trying to say is we need some kind of institutionalization of science. Thank you.
Thank you, Priyan. We will have a few questions at the end of the session rather than at the end of each intervention. I would now like to invite Professor Dr. Sirimali Fernando, who will actually pose the question on what is it that we mean by institutionalizing science advice? That's the core of the intervention that Dr. Fernand will make.
Thank you, Ranjit. Before coming to institutionalization, I think, just to add that, mistakes or not so good decisions on science and science policy advice have been taken all over the world. We know Chernobyl is a good example, the Challenger disaster is a good example, even the BSE, the bovine spongiform encephalopathy, because people said it's not going to cross the species barrier, and in a few years the humans were affected. So this is bound to happen over and over again, and even in the future, even if we institutionalized science advice, I think we have to expect these things. We are human, right? But having said that, yes, I think it's quite obvious now that the institutionalization has become a necessity now rather than a choice. Because if you look at how science advice has developed over the years globally, the US has a very strong science advice program going back to century. So is US, the Royal Society had been there, very much advising the UK government, and the US, in the US, it's the Office of Science and Technology Policy, OSTP, that had been there. And you can see they have been giving very sound advice, and the science has flourished. But it didn't become such a, I would say such a vogue in the past until quite recently, very recently. This all happened in this century, 21st century, mainly because I think with the internet coming into the picture, the technology is being developed, we have started generating a large amount of data. And to organize this data and to use that data became a challenge. And with that, the question arose how we best use this data for science advice. And this was one of the main reasons why initially these were done by science academies and science organizations globally, discussing how we should best utilize the existing information for evidence synthesis. So I think it's true the evidence synthesis is the most important thing, but how we use and what data is very critical. Because we are now, I think we are supposed to be generating about 400 terabytes of data every day. It's a huge, and that's why we need huge data centers around the world. We have few in Sri Lanka, but unfortunately, the science data is not that well organized. They are scattered, fragmented in institutions. I know NSF has a whole lot of data. Institutions have their own data. But all the satellite data and all kinds of data needs to be organized, and that should be part of a science advice system. So if we are to really organize everything, we need an institutional mechanism. So that we need trained people. It's just not the process, but even the skills should be institutionalized. We need trained people, very specialized training on data handling, and data policies should be there. And now the data synthesis, just as much as we do meta-analysis, but as Saroj quite rightly said, the AI is coming in a big way. There are many AI platforms for data synthesis, not only the platforms, but also standards. Standards for managing data, standards for evidence synthesis, all that is now there already, and countries are using them. So I think when we look at the global scenario, we are far behind. And we have to get into this. And if you institutionalize, as Saroj said, even if you are dead and gone, the system will run. And that is why the institutionalization is necessary, to institutionalize the process and the people. Both should happen, and we should have a very transparent mechanism of organizing this whole process of science advice.
Thank you, Sirimali. We'll now move on to the question of whether we need an institution, and I would like to invite Mr. Prabhat Abesirivardhana, who is deputing for the Secretary, Mr. Nawan.
Thank you. I think as ministry, we are now most of the time depend on data-driven decision making rather than looking at something and then to provide the solution to that problem. We depend on data. So as a first step, we usually in past we look at progress reports and those things, but it is not enough. So we strategically implement KPIs. So based on KPI data, we try to make decisions. Then the other thing is that as a ministry, in ministry level, we need take policy decisions. So for that, we need policy-driven data, actually. As Professor Sirimali said, there are many data, generated terabytes of data, even in a split of seconds. But we have to separate some data for policy making. That is the challenge for the ministry. So, as you said, institutionalizing is very important in this regard, particularly when we, let's say, we want technology assessment, impact assessment data. So, in institutionalizing, we can define that some tools that will acquire data from particular areas. So, institutionalization means very big subject to be discussed, but I think as a ministry we initialized several initiatives, regulatory impact assessment and also technology assessment. Those will, I think, generate data for policy, for policy making. I think it's a very important thing in modern world.
Thank you, Mr. Prabhat. We now move on to a very important aspect, how the stakeholders and the community get involved in this process, because that is something that we are not usually doing. We don't consult people, we don't consult our stakeholders whenever we make a decision. And I have great pleasure in requesting Dr. Vinya Ariyaratne to speak on that.
Thank you, Ranjit. Good afternoon. So the question is, how do we ensure community and end user engagement in the process? Firstly, I think it's important for us to recognize that the ultimate objective of evidence-based policy is to promote the well-being of our own citizens and the community. Policies get translated into strategies and activities that will address the pressing social and economic issues faced by the citizens. Now, communities and individual citizens ultimately bear the brunt of impact of national policies, whether they are negative or positive, already being referred to earlier. So, we have enough and more evidence to demonstrate that it is a moral imperative that citizens and communities are involved in the policy making process at every step, starting with the policy formulation and of course the implementation process. So when we explore the ways of institutionalizing science-based science advisory, we can confidently say that the rich social capital and grassroots networks that exist in our country can play a very crucial role in enhancing monitoring and accountability in evidence-based policy making, and this can happen through several mechanisms, and let me elaborate on this. First is community engagement and voice. Now, grassroots networks foster active participation from community members, ensuring that local knowledge and experience inform policy making processes. This inclusive approach can help identify issues as well as validate evidence by those who are directly affected by these policies. It also can use the indigenous knowledge that we often forget. Not that all indigenous knowledge systems are positive, but still I think there are large knowledge bases that we can tap into in generating evidence. Secondly, it is the information flow and transparency. Now, social capital facilitates information sharing within communities and between citizens and authorities. This transparency enables the detection of any discrepancies, corruption, or inefficiencies, fostering accountability in relation to policy implementation, which is weak at the moment in our country. Thirdly, collective action. Strong grassroots networks enable communities to organize collective actions such as advocacy, which has been referred to earlier by Professor Ajit, watchdog activities or reporting mechanisms, grievance mechanisms that hold policymakers and implementers accountable to their decisions. This is the modern day accountability which goes beyond elections. Fourth point is that trust and social norms. Merely creating institutional mechanisms for evidence-based policy making will not ensure success. You need public trust, and the theme, one of the words used in the theme for this week is trust. And high levels of social capital build trust among community members and also between public institutions and the public. This trust encourages honest feedback, reduces resistance to change, and supports adherence to evidence-based policies. We know that without positive public opinion, often very progressive decisions have been reversed because the public opinion is not there. The reason is that the public is not properly informed of the science behind or the evidence behind such proposals. 5. Capacity building. Now, grassroots organizations can play a advocacy role and also provide training and support to community members, empowering them to access evidence, monitor policy implementation, and demand accountability effectively. Finally, reducing power asymmetries. These networks can help to democratize decision making by distributing influence more evenly, ensuring that particularly the marginalized voices are heard and considered, thereby improving the legitimacy and responsiveness of decisions. We know that we are living in an age of social media. Lot of misinformation and disinformation is being disseminated in very short period of time, countering sometimes very intelligently taken decisions, and those decisions are also reversed. So in engaging citizens, I think something that has not been referred to is the community science. National Science Foundation is having a program called Popularizing Science in the Public Domain, and then this is of course a very critically recognized new initiative. And citizen science is actually, we know that it's the practice of public participation and collaboration in scientific research to increase scientific knowledge. And citizen science involves contributing to research, while public engagement allows citizens to voice their perspective to inform policy, and supporting specific organizations to help strengthen the infrastructure for scientific advice. So it's not just the top level, national level institutionalization, but also connect through community science, the grassroots network. Then we have a complete ecosystem which can really be very powerful. So let me conclude by saying the social engagement, particularly through social capital and grassroots networks, enhance robustness, transparency, and inclusiveness of monitoring systems, and thereby strengthening accountability in evidence-based policy making. Thank you.
Thank you, Dr. Ariyaratne. That was very informative. With these 4 brief remarks on how we do this, one of the last questions is, how do we take forward this? I think that is the most important thing. What is the outcome of all these things that we discuss? Is it just a meeting, or what do we take from here? What agreements do we make here today, at least preliminary agreements? And I now invite Professor Saroj Jayasinghe.
Thank you very much for putting me in the hot spot. Yeah, I think the first point is that we have to have political commitment, and there is political commitment from what we see, because the ministry has been very enthusiastic. The minister also has been enthusiastic on this, and there is a general agreement in the higher power structure of the government that science and more evidence has to come into the system. But I think we must get their commitments for that, because unless they say, and all the top organizations like NSF and NRC and NASTEC all agree that this is a important endeavor, there is no point in trying to waste our time. So that's one. Then I think once we agree that something has to be done, then we'll have to discuss and see which areas we are going to pilot this. We can't have a complete overall of the system. We'll have to think of a few areas where we do a very good situation analysis, and the leadership of those ministries agree, or those sectors agree, and the trade unions also agree, and the community also wants those areas to be. It might be things like social welfare policies or some such thing. So where the community has a huge stake. So once we identify the key areas, now that's outside, in a sense, outside the scientific community. That policymakers have to tell. After that, we can engage more with the process. And Ajit mentioned this in one of our discussions with the ministry, that we should have a series of workshops to see the need in these sectors. So we have identified, we say 3 sectors or 5 sectors. So we'll have to have a process within each of these sectors, maybe consultative meetings or workshops, which will identify what model they want to have. They might want an advisory council, they might want a commission, like the National Education Commission, or the government might say, no, we want a uniform thing for all 5. That's up to them to say. But I think we'll have to have that process of discussing, with the ultimate aim of saying this sector or this ministry will have such and such an institution for providing science advice, council or commission or whatever. And within it, they will have to then decide the process. So it's a huge, I think it's a huge undertaking if you have to go in a systematic way. At the end of the day, 1 year, 2 years, 5 years, or 10 years down the road, there should be legislation for each of those institutions which are being set up. There should be circulars within those departments. There should be regulations to say exactly how knowledge is going to be tapped, evidence is going to be synthesized, presented, and so on. And in addition, parallel to this, we will have to think of capacity building. So this is where SLEDA comes in. We should be bringing in modules so that which will help the future administrators and retrain the present administrators and policymakers on how this process runs. And as that Nature article says, the scientists also must start to know how to synthesize knowledge, what's the model they are going to use, what are the models, how are they going to communicate. So it's a rollout, I think, which is going to span maybe several years at least. But pilot ones we should be able to, yeah. That's the sort of roadmap which I could propose. Thank you.
Great. I think that's a good start for the process. Let's hope in a few years we'll have something. Definitely, yeah. So as Professor Jai Singh mentioned, there are 2 other things that we need to look at. One is, of course, the capacity development part for the officials, and maybe retrain the existing people on this process. Firstly, the importance of the process and how to actually get that system into their heads. And that is, I think, SLEDA is leading that, probably will lead that process, and I invite Mr. Janandara to make a few words.
Thank you very much, Dr. Mahindapala. So first, I would like to thank you for inviting SLEDA for this forum, by recognizing the importance of SLEDA in this process, especially the way forward. when it comes to public policy making in Sri Lanka, the public policy making under this institutional setup is completely done by the politicians and some of the organizations like quasi-political organizations like Public Service Commission, Monetary Board, not the bureaucrats. The implementation part is completely done by the bureaucrats. So now, having said that, when it comes to policy making, I'd say that it is entirely done by the Cabinet of Ministers, Presidents, the political appointees, and various other organizations like Monetary Board, the Public Service Commission, and those independent commissions. But I remember that when Professor Abhisekar in his speech mentioned that, Professor Saroj Jayasinghe, when you submit a lengthy report, President cannot read all those documents, and it's probably he might receive 1,000 odd reports per 1 month. So the officials in the ministries, secretaries, assistant secretaries, senior assistant secretaries, directors, those are the people who read all these reports and advise the politicians. In the cabinet office, the same happened. So SLEDA mandated to train those public officials. That is where the SLEDA importance coming. From the beginning of their career, from the induction to the capacity building, throughout their professional career, SLEDA mandated to train those officials. Now, not that they like to train under SLEDA, but they are mandated. They have to come to SLEDA. So it is a compulsory training, so they have to come to SLEDA, administrators, planners, education administrators, engineers, scientifics, those people are from the scientific service, they are supposed to train the SLEDA. Now, when it comes to decision making, in our jargon, evidence-based policy making, that is the jargon that we use in public policy, based on 3 aspects. One is data, other one is research, the last one is systematic analysis. If I'm not mistaken, we have a scientist here, I'm not a scientist by profession, so that is what is all about science decision making. So when it comes to evidence-based policy making, those are the 3 key elements. Now, in practice, in our organization, bureaucrats made their decision by intuition plus tradition. By intuition plus tradition. And as Professor Tynes correctly mentions, the politicians, when they make policy decisions, they have to think about the public opinion, political opinion, various other reasons. Bureaucrats, same. But in my experience, in most organizations, tradition and intuition are key elements when it comes to decision making, whether it's policy level or maybe operational implementation level. So we have to find a mixture, a better mixture. If you can make it, say, 70 to 30 or 80 to 20%, 80 science, the policy decision made based on science advice. So we have a right mixture because we cannot completely ignore those traditions and the intuitions embedded in such organizations. So the question asked me about the practical, how we going to way forward. So at the moment, in most of our training programs, we are teaching them the public policy. And in those modules, we are teaching them evidence-based policy making. And in recent past, we have introduced AI-based tools for them to make decisions. Bureaucrats, the student of our organization, the public officials, they are happy to learn all those things because that makes their life easy. I can tell even ChatGPT, Microsoft BI, whatever it is. Now, those models, those AI models, definitely based on scientific advice because they are linked with all this data and all these things. So it automatically make tendency to refer the scientific data available by using digitalization. So that is one move that we have already been initiated at SLEDA. But to move forward, I would suggest in short term, we can introduce modules for our training programs about science-based policy making, a dedicated module rather than having a session or two on this particular thing, what we are doing currently. So that is one move that we can recall. The second thing that I can think of is to have kind of a forum or symposium with the aid of, there are few institutions like National Science Foundation, NASDAQ, coming under the Ministry of Science and Technology. So we can have a forum, probably next year. We have funding within the SLIDA and our research and development divisions we can have. So we can bridge the gap between science advice and the policy making, and also make awareness among bureaucrats. Naturally, bureaucrats, they are, unlike the gathering here, they are not fond of these science advice, right? That is natural, in my opinion. But we have to create the awareness among those people. There are few among those people who are fond of researchers, who are tend to do researchers, so we can encourage them, we can compensate their thinking. So bringing those people and recognize their effort and increase them. Last thing is, by doing all those two aspects, to create a culture among public sector officials to make their decisions based on sciences. That is, I think, a long-term prospect. So those are the three things that I can recall under SLIDA umbrella for this purpose, the way forward to embedded science-based evidence into public policy making process, especially among bureaucrats, which we are supposed to train at SLIDA. So the ultimate objective, as Dr. Ariyaratne mentioned, that to increase the welfare of the people and bringing better results and efficient results to them. So finally, I would again thank you, the organization, organizers, the ministry, for inviting us, SLIDA, for this program. It's a really practical way to move forward, because we are supposed to train these people because of our mandated. So we have avenue, and with your support, we can initiate these programs long term and short term. So hopefully we can create a decision-making culture that are supposed to make their decisions based on science advice, rather than, in my word, evidence-based policy making and decision making. Thank you.
Thank you, Mr. Janendra. It's most encouraging to hear that the SLIDA is already thinking of having this science forum with the administrators. And finally, I'd like to invite the General Secretary of the Sri Lanka Association for the Advancement of Science, Dr. Attanayake, who will tell us how the broader scientific community will be engaged in the process.
Thank you very much, sir. So I would like to draw your attention. As the Sri Lanka Association for the Advancement of Science, we started, the current official started the year in January 2025. So we had the chance to engage with students who are doing very rural areas, science, in schools, Hambantota, Anuradhapura, Jaffna, Belihulloya, all areas, to the Vidata scientific officers who are working for the communities. I think it covers very good stakeholders who are interested in science. And I would like to say now, even though we talk about this AI analytics and this all images, Google image analytics and all sort of things about science, It's really pathetic when you go to the grassroots level. For an example, we hold many science days at schools, and we thought of, okay, we are having our science day program at particular school which is very rural area. For an example, if I say the last one we had in Jaffna, and we thought of, okay, we will be getting a feedback from them, which is not guided feedback. How is the program, and are you going to do science in your A levels? Not like that. General feedback. Okay, what are you thinking about the today's program? Most of the people, honestly, very honestly, we have the records, and at the same time, we need to thank National Academy of Sciences for funding as well, for facilitating all these Science Day programs. Almost all the feedback is about food. Okay, you have served nice food, and some are saying, okay, this is not enough for 6 hours, and all sort of things. So we are talking about all these Google Analytics, AI analytics of data, and NASA images, and all sort of things. But we need to go and see really to the grassroots level and where the problem lies. And if you take now this very superficial things like Feng Shui, it's very easy to get those into the society, because the manner they advertise, okay, you will get this, healthy life, and all sort of things. Whereas we science, of course, we are trying to be all the time, okay, if you do science, you will get into this path, you can do these things. And so we are not that attractive. And the other thing is, even if you are generating data, of course, yes, we have many data. But the thing is, interpreting data, synthesizing data, there's no humanity part in interpreting data. So we are talking about all these graphs, trends, and all sort of things. But if you go to the grassroots level and do some kind of a qualitative data analysis, it's not what we are thinking of at the grassroots level. So we have been doing all these things throughout the year. And for an example, now with the ministry also, Sri Lanka Association for the Advancement of Science, we are doing some kind of capacity building or problem solving program with Vidata officers, right? So just being in the ministry as the officials, talk to some of the Vidata officers and see how they are struggling to solve scientific problem. And we are talking about AI, Google Analytics, and all sort of things. It's very difficult. The officer who's handling this Vidata program must be knowing how difficult these Vidata officers to solve problems scientifically and get into the society, get into the community. So it's good that we initiated something like that through an institution. We can solve the real problems in the society. Our stakeholders, rural areas, all these school children who are willing to do progressive studies in science, how can we solve them in a manner? It's not purely science, but you need to add some social factors as well. So I think that where we should start with the capacity building as well. So our minds are set, all these science, analytics, and all sort of things. It's not the case. We need to add some humanity to all these problems. Thank you very much.
Thank you. Running out of time, but we have a few minutes for a few, maybe 2 or 3 questions, very specific questions if you wish to direct it to a particular panelist or need clarification from a panelist on what he or she said. Just very quickly. Yes, sir.
Thank you. My name is Dr. Piyala Arenanda. My question goes to you. The problem is actually the science is not well communicated to the general public. If you take any video on the Facebook or on YouTube, there are so many entertainment videos with millions of views, but scientific videos get very few hits, or attention. The reason is actually we are not communicating science to the feelings of the general public. I think last couple of years, the SLBC had a scientific program called Anantaya, and it was stopped during the COVID. That reached out to some audience, and it was very well taken. I think as the scientific institutions, we should be taking sciences to the general public in a palatable way, those who can understand in a very general way. I think if you can do something to that, that will be very helpful for the nation.
Thank you. It's an excellent proposition. In fact, I think...
Yes.
Yes.
I am Professor Rohan Fernando, that chairman of the NASTEC. Just want to tell you about the policy. I think we were talking about the policy for a long period of time. We had the policy, and finally it has been approved by the cabinet, and they made the gazette. And this is a piece of paper, right? Since after that, nothing will happen, right? That is the reality. Once that government has changed, the policy will change, but these papers are still remain on the table, right? What I propose is, usually that whenever you are having this one, that particular aligned ministry must have a roadmap to be developed in the next 5 years. That is, should be the roadmap of the particular policy. For an example, I will give one example, very good example that has been occurred in the last week. Ministry of Industry and Entrepreneurship Development. They have given us all the institute under that particular ministry, right? Industry and Entrepreneurship Development. That they have gathered that all of the members and asked all of the members and the chairman and that DGs and all of the people, right? Ministry has developed 2 policies. One is the national policy on national industry policy. The second one is a national mineral policy. What they have told us, this is the policy that we have adopted, and roadmap would be, you have to develop the roadmap based on these 2 policies, right? And then we were asked to do that 5-year plan based on these 2 policies, and then all the ministry goals will automatically be fulfilled by all the aligned institution based on that. This is what I really wanted. For an example, we have transport policy that has been drafted. I don't know whether that has been approved. The transport ministry has to go with the transport policy. And national health policy, again, health ministry should have gone with the aligned with this. Roadmap would be that. And for the science and technology, and again that we have developed the national science and technology policy in the 2008, but it is on paper in the NASTEC. It is there, right? That is there. Nothing has happened. And then also that we have developed in this year national R&D policy, but we will make every effort to realize this one through the roadmap to realize the national R&D policy. That will make definitely by ourselves, and this is the way that we have to follow it up the policy. Otherwise, that there is no point to have a policy there, and that's why my point. Thank you.
Okay. May I add a word? Thank you, Saroj sir, Vinarayan sir, for these interesting points. So now my point is, you were talking about evidence for policies. So in health sector, we all come from the health sector. To a certain degree, during policy generation, we practice this. All the aspects that we were talking about here, KPIs, and then we look at available evidence, and we have community engagement, we have stakeholder meetings. We do to a certain extent. Scope for development is always there. But we were also talking about AI into meta-analysis and systematic reviews. That's a dangerous thing, because garbage in, garbage out. If by any means, the ChatGPT or any AI, they select the wrong evidence because evidence is based on a researcher's finding and the quality depends on the methodology. So I rest my case there. So we have to train our researchers, all the policymakers, to compile all the available, the good quality research so that we don't end up with meta biases into policies. Just a comment. Thank you.
Good morning to everyone. I'm Dr. Tilina Vanigasekara. So I wanted to add something to Dr. Anuji because now all are talking about the policy and policy making only. But we are having, as Professor correctly said, the Chairman Nastek, we are having policies, but the implementation is the problem. As a health ministry personnel, so we had our health policy for up to 2026. Now we are heading for the 2026 to 2030 policy also. And at the version of it, the last few years, we not only had the policy, we had the health master plan and also a strategic framework to implement that. And all the other settings were aligned with that. So mostly we tried, I think, our best to align with all these strategic frameworks. So I think all the other areas where the policy only implemented, so I think we need to have a certain kind of a involvement in implementing policy in a scientific manner. Right, so I'm proposing that not only the policy making, I think there has to be a national level guidance to make it happen in all the ministries. So we talk about that policies are there, people are there, a lot of experts are there, but policies are idling. So I think I propose that also a part of this policy making, evidence selecting and also research and also implementing in a strategic way. Thank you very much.
Thank you. Anyone would like to respond?
Yeah, what I would like to say is that, I mean, this particular area which we are trying to address, it's not going to solve all problems. We can't. But I think it's trying to improve the existing situation by asking how can we get the evidence in a systematic way into the policy making. I mean, I quite agree that's just a part of this whole policy making process, and there are more important things in relation to policy. But I think we are focusing on a different area, on a specific area, because we find that there is a lot of variation, and as you quite rightly mentioned, Ministry of Health is probably we are different in that sense because we have a lot of technical expertise within the ministries, and they work very closely with the universities, the research organizations, the research meetings and so on. So I think we are focusing on this narrow area of how to streamline this. So this is why we can't be too ambitious. We'll have to identify a few sectors or ministries and then try to see whether we can move 1 inch forward. We won't have 100% success. It's always a case of shifting the Gaussian curve by a few inches to going forwards. So even with community engagement, I think it's a very important point because otherwise we lose track of the relevance, you know. And what we are talking about is probably not reflecting what's at the grassroots level. So my response is we have to look at a small area to begin with. And certainly the National Academy of Science can help in that area, I think, more than the other areas. Yeah.
So once again, just some thoughts off the top of my head. I think now some of the questions that Rohan and, sorry, I forget your name, but you are asking about, okay, there are these policies, why aren't they implemented? So that is what I mentioned also at the start. You know, Saroja's slide said evidence, scientist, policy. So that does not seem to work. But at the same time, it's not as if things don't get implemented. There are various things that governments do. I mean, whether it is to give us Vesuma or whether in the past, I mean, I talked about fertilizer decisions and things like that. So I think we need to think more in terms of before governments do things. You know, now we are familiar, especially in the engineering community and others also, environmentalists, about this environment impact assessment, right? So I think we need to think about these things more in terms of a science impact assessment. In other words, before governments do things, they should try to make sure, okay, what are the implications of this? I mean, what is the science? I mean, especially in some areas, you know, there needs to be scientific advice and what shall I say, synthesized scientific advice getting different viewpoints before those things are implemented. Now, the kind of things that you are talking about, you know, having the policy and making sure that it continues, I feel in order for that to happen, to some extent, I think it happens even in a country like India. Now, I am open to correction. That is because the Indian civil service is a very powerful organization. I don't think the ministers can do what they want with the Indian civil service. They have continuity of policy because of the strength of that. I mean, so I'm saying this especially because Director Slida is here. So I don't know whether we can come to that kind of level and, you know, what the pros and cons of that are and things like that. One final comment again, the gentleman here, sorry, I'm a bit ignorant about people's names and things, about taking science to the people. So just to say that the National Academy of Sciences is involved in a program called Rebuilding Trust in Science. We are just trying to present some of the science done in Sri Lanka that has been implemented in 10-minute slots in Swabhasha. And this is led by our current Vice President, Professor Malik Ranasinghe, who has been able to get some sponsorship and also tie in with, what is the television network? Derana. So we don't know because, you know, we are aware of our own limitations to, you know, like you say, create interest and that kind of thing. We are trying to get advice from experts who do that kind of thing, how to do it. It may not be successful, but at least we are trying to have, you know, some kind of concerted effort to get scientists to speak in their mother tongue to the public and to create and some enthusiasm about science. We hope things will be, something will happen out of that. Thank you.
Thank you. Just to add what Priyan said on this, how to communicate science. In fact, I think we have identified about 50 topics already, how we should do it. I have to admit that we're all struggling how to convey this. And I think that's the art that we are seeking specific guidance from people who do this. And I don't know if Ajit wants to say anything, but hopefully we will do something to convey this, you know, these spots of science in 10 minutes so people can understand what science has achieved in better than what it conveys on paper. I think we have almost reached our time limit, and I'd like to take this opportunity to thank all the panelists for their excellent interventions and presentations and suggestions, and hopefully, and for the audience for their enthusiastic questions and responses. But above all, I think at the end of the day, as Professor Jayasinghe mentioned at the beginning, and Professor Ajita Besekara, we at the Academy would like to see an outcome of this, a slow process nevertheless, but some concrete proposals to take this forward. It's not easy, as Professor Jayasinghe said, maybe a start would be a very good outcome of this whole exercise. And thank you very much indeed, and a good day for you.
Thank you to all our panelists and Dr. Mahinda Pala for an engaging and forward-looking discussion that identified clear strategies for strengthening the science policy interface in Sri Lanka. Ladies and gentlemen, we now move to the concluding session focusing on the roadmap to implement evidence-based policy making. This final segment will draw together the key takeaways and recommendations from today's forum, followed by participant reflections and contributions towards the implementation of the report's proposal. To lead this important session, may I now invite to the stage Professor Saroj Jayasinghe, Fellow of the National Academy of Sciences, Sri Lanka.
Thank you very much, and it's been a pleasure to interact with all of you and to take this discussion forwards. And as you know, we started with Professor Nadira, who described the international experience from a study which we did. And then I focused mainly on the nitty-gritty of trying to disentangle this whole process, what we mean by science advice or taking advice into policy. And then we had very interesting presentations and discussions on exploring these in further detail. So my task is actually to talk about the roadmap, and I briefly mentioned this of the need to have political commitment, and then get on into identify the pilot sectors or ministries or where we want to focus on, which has to be done by the policymakers, and that it's in their purview. And then once we do that, we will have to have a series of activities. So the point number 3 onwards would be the practical activities we'll have to take on with if you have to make progress. Maybe a series of workshops which will come up with some recommendations, and we can use the local expertise. We have a lot of expertise within the country as well as from our international networks who can come and share areas which are relevant to us. And when it comes to implementation, sorry, you can't see it there, you have to, at the end of the day, we have to think of drafting legislation and proposing certain amendments or circulars, and a shift in the culture of this decision-making process. And as quite rightly mentioned to us, it was there's a lot of intuition involved in these policy-making processes, and also you heard from SLEDA on where the decisions are being made. It's at the commission levels, finance commission, treasury, and planning departments, and so on. So parallel to all this, we have to think of capacity building. And for those who are interested, there is an online course which is being conducted by the International Science Council. It's free. Yeah. Right? And if you go to the International Science Council website, you will be able to access that link. And from that, you can follow that course. It's starting, I think, on the 30th of November. It's free of charge. So you can get an idea of the sort of the science behind evidence into policy. Yeah. So that's all I have to say, Ranjit. If there's anything else to add. Yeah? Right. Okay. Thank you very much. Yeah.
Thank you, Professor Saroj. Ladies and gentlemen, as we conclude today's forum, let us carry forward the message that effective governance begins with trusted knowledge, shared dialogue, and collective resolve. We extend our sincere gratitude to all guests, speakers, and participants for your contribution. So just before we conclude, I have a quick announcement to be made. Those who are taking part in the afternoon session are kindly requested to move to the Nelum Hall for the next part of the program. Also, please scan the QR code which is on the table so that you can fill the feedback form, and also the details from the feedback form will be taken when developing the participation certificate. Thank you once again, ladies and gentlemen, and have a pleasant evening.